Hi. Today I'm going to talk about the multidisciplinary team. That's the group of professionals or co-workers you are going to be encountering as you work. You know how back home you do everything. You are the doctor, you are the nurse, you are the pharmacist, you are the med lab scientist, you are the dietitian, you are the security man, you are the plumber, you are everything. Well, it's not that way here, at least not 100%. So I'm going to run through many of the professionals you are going to encounter. I will not be able to say everybody because there is a lot, but I will focus on the most common ones. And even then, I cannot cover it in one video because I want to keep the video short within 5 minutes. So let me start. So there is, of course, our good friends, the doctors. There is the doctors or providers or physicians, and then there is the physician assistants. So they have assistants, they have people who work with them, assist them. And then there is the med lab scientists and their technician. There is the pharmacists and their technicians. There is the nutritionist or dietitians and their technicians. So your encounter, you might not see a face for a pharmacy or a med lab scientist or a dietitian, depending on where you work. But it's more common for you to have interactions with their technicians. So that's it with that. Then there is the case managers. The case managers are nurses and they are like coordinators. They coordinate the care of the patient, bring in input from every member of the multidisciplinary team to try and bring out the best, process or experience for the patient from the beginning of their stay to even after they leave the hospital. So that's what the case managers do. Then there is the advanced practice nurses. These are the nurse practitioners. These nurses, just like the name implies, they're advanced practice. So they have prescriptive powers. They can treat patients. They can stand in for the doctor depending on their scope of practice in that facility and that state. So that is it for the nurse practitioner. Then there is the educator, the nurse educators. There's a nurse educator, just as the name implies, they educate nurses. The nurse administrators. There are other general administrators too, of course. So this group of people are people you are going to work with. Everybody has a role to play to ensure that the patient gets the best care. So noteworthy is that this group of people may bring in, may have orders in the patient's medical record that the nurse should carry out. So you can get orders from pharmacy, you can get orders from the lab, you can get orders from dietary or nutritionist. You can get orders from wound care. That's another set, wound care nurses. So in the orders that the patient should get, which you should be reading and should be carrying out for the patient, you will find that all these other professionals may put in one or two things they want you to do for the patient. Then on your side, if there is any need for clarification about any aspect of the patient's care, you can call the pharmacy, you can call the lab, you can call the dietitians, call wound care, you can call the advanced practice nurse, you can call the doctor. So you can call all of these people to clarify what needs to be done. So everybody works together to make sure that the patient gets the best. So thank you for listening. In the next video, I will bring up all the other people that we work with. Thanks for listening. Make sure to like, share, subscribe, and follow for more.